Assalamu alaikum friends. Today we will discuss erythroblastosis fetalis. First of all, we will go through what is meant by this word. So this word is erythroblastosis. The word erythro means RBCs and blastosis means that there are large immature cells, and fetalis means fetus or related to fetus. So what erythroblastosis fetalis means that the disease of RBCs of the fetus. Now what is the history before this disease? What are the facts that promote towards erythroblastosis fetalis? So it happens when an Rh negative mother conceives a baby that is Rh positive. Why? Because the father was Rh positive. To understand this erythroblastosis fetalis, first of all we will see that what is this Rh gene, what is this Rh antigen. So the gene for Rh antigen is D. Okay, whenever we have D, capital D and capital D, the human will be having the gene which is Rh positive, and it will be called that he is positive or she is positive. And whenever there is a capital D and small d, again it's dominant, and the individual will be positive. And then comes small d and small d. Small d is the case when the person will be Rh negative. Means that it will be having no antigen for no Rh antigen on the RBCs. So this was a fact. Mother is Rh negative means that mother has no antigen. Mother has no Rh antigen, and if the mother's blood is not exposed to the Rh antigen, then there will be obviously no antibody, Rh antibody. So mother's blood contains no Rh antigen and no Rh antibody, while the newborn's blood contains Rh antigen. Okay, because the baby is Rh positive due to his or her father. Now one thing which is called placenta. What is this? Placenta is the connection between mother and the baby. It is the connection through which the mother's nutrients and circulation gets entered into the baby, and baby dispose of its waste materials into the mother's body. This is the connection. This is a maternal and maternal fetal connection. When this Rh positive blood will pass through the placenta and will be drawn into the mother's circulation. Mother is Rh negative, baby is Rh positive. So there will be the exposure of Rh antigens. So when there is Rh antigen exposure, there will be stimulation of the immune response. The mother will cause stimulation of its immune response towards the Rh antigen. Why? Because this is the blood containing Rh antigen, but this blood is not containing any antigen. But when this blood gets entered into the maternal circulation, the blood containing Rh positive means Rh antigen will stimulate the mother's circulation, mother's immune response, and the mother will start producing Rh antibodies. Now what happens next? When these Rh antibodies pass through the placenta into the newborn, the Rh negative antibodies will combine. What will, because see, this is a RBC and it's containing this Rh antigen, and now here comes the mother's blood which is containing Rh antibody. Now this antibody will combine with RBC, the antigen, Rh antigen on RBC, and this will cause the agglutination. Agglutination of the RBCs of the fetus. When there is agglutination, we know that after some time of the agglutination, the macrophages came there, monocytes came there, and causes the phagocytosis. So the phagocytosis occurs here. Phagocytosis means that lysis of RBCs takes place. Okay, whenever there is RBCs, these antibodies, the maternal antibodies, circulate in the baby circulation for about 2 months after birth. Here, what these antibodies will do? These antibodies will stimulate further hemolysis, obviously, because antibodies are circulating in the baby, which is Rh positive. So here again, these antibodies will agglutinate in the RBCs and continue towards the lysis of RBCs and causes the bilirubin accumulation. Now, to compensate this, means that RBCs, obviously, when there is continuously lysis of RBC, the baby will be anemic. And whenever there is baby will be anemic, hemostasis will occur. Hemostasis, to compensate this loss, liver and spleen will swell, will become enlarged in order to produce large number of RBCs to compensate the loss which is occurring due to agglutination, due to lysis of RBCs. Okay, the liver and spleen will swell, but they try to compensate, but because in short time they have to prepare the RBC, so the RBC produced will be large nucleated blastic forms, which is so called as erythroblastosis fetalis, because the RBC size will be large, they will be immature, and they will be produced in large amount because baby is anemic. So due to this form, the disease is called erythroblastosis fetalis. We know that there is continuously lysis of the RBC. RBCs are undergo lysing and continuously. So the bilirubin released will be accumulated in brain, because bilirubin released will be unconjugated bilirubin, because it will be produced in large amounts, so the liver will unable to conjugate the bilirubin. So the unconjugated bilirubin level increase in baby, and this unconjugated bilirubin will pass into the brain and causes the kernicterus, because bilirubin is accumulated inside the brain, inside the neuron, inside our brain, it gets accumulated there. And this will lead to the kernicterus, which can lead to the permanent mental impairment. So the two conditions are here, that baby is anemic because RBCs are undergoing lysing, and the second thing is that hemoglobin release is converted into bilirubin, so there is high level of bilirubin in the blood. Bilirubin will pass through the circulation and into the brain and causes the kernicterus, which can lead to the permanent mental impairment, and anemia itself can cause the baby death. So this was the whole summary of the erythroblastosis fetalis. Now once again I'm gonna repeat it, that Rh antigen, which is present on the RBCs of the newborn, passes through the placenta and gets entry into the mother circulation. Mother circulation, on entry into the mother circulation, the immune response will be stimulated and it will be producing antibodies, Rh antibodies. Rh antibodies then again pass through the placenta into the baby and causes the agglutination of RBCs there. Agglutination will lead to the lysis of RBCs, and whenever there is lysis of RBCs, hemoglobin will be released. Hemoglobin gets converted into bilirubin, and bilirubin then causes the jaundice. Two conditions the baby will born with is severe anemia and jaundice, and when the baby is born, the antibodies circulating still inside the baby causes a further hemolysis. To compensate this loss because of circulating antibodies of the mother inside the baby circulation, the spleen and liver forms immature RBCs, which are called nucleated blastic forms, and the disease, because of this name causes, is called erythroblastosis fetalis. Bilirubin gets converted hemoglobin gets converted into bilirubin. Bilirubin level will be high. It will pass into the brain and will cause the chronic tears there, which can lead to the permanent mental impairment and baby death.